Hello everyone, welcome to Dentospedia, one of the best platform for global dental board exam. And today I am going to give you a short lecture from endodontic module, that is endodontic emergency. Coming to endodontic emergency, the importance of this chapter does not hold only theoretically but also clinically. So as to how to handle a patient with emergencies during endodontic treatment or during root canal treatment. Coming to the introduction, what are endodontic emergencies? Endodontic emergencies are the condition with pain and or swelling which need immediate diagnosis and the treatment. So these are the emergency conditions which require immediate diagnosis and the treatment. The most commonly caused, so these endodontic emergencies are most commonly caused by pulpal pathologies or by any traumatic dental injuries. The pain here arises mainly due to first is the chemical mediators. These chemical mediators they lowers the nerve threshold and so increases the vascular permeability. And then the pressure buildups which stimulates the pain receptor. The pulp chamber is inside the rigid dentine. Yes, and this dentine follows the wall outside the pulp. So here the pulp cannot expand after a certain level because here the pulp is confined within the dentine. So this swelling causes extra pressure buildup which causes pain. Then coming to a proper definition of endodontic emergencies, an endodontic emergencies is defined as pain and or swelling which is caused by inflammation or infection of pulp and or periradicular tissue which necessitating an emergency visit to the dentist for immediate treatment. So the definition is as simple. It is an endodontic emergencies which may be defined as a pain or the swelling and due to any infection to any infection in the pulp or the periradicular tissue which causes an emergency visit to the dentist. Now coming to endodontic emergencies classification, before treatment there are crown originating fractures, symptomatic reversible pulpitis, symptomatic irreversible pulpitis, primary symptomatic apical periodontitis, secondary symptomatic apical periodontitis also known as phoenix abscess, very important from exam point of view, symptomatic acute alveolar abscess, cellulitis, or any traumatic injuries like crown or root fracture, luxation, or avulsion. These are endodontic emergencies before the treatment. While during the treatment, the endodontic emergencies may happen that are hot tooth or endodontic flare up. While coming to after treatment, endodontic emergencies are post obturation pain or vertical root fracture. So these are all endodontic emergencies which are classified before treatment, during treatment, or after treatment. So thank you everyone. Thank you for your cooperation. This was a short lecture from the endodontic emergency. To learn the whole chapter with MCQs, diagrams, and flow chart, please follow our Dentospedia app today. Thank you.